Hello, this is the video submission for Team 6, Group 6. My name is Juan Torres. I am not the leader of Group 6. I am a group member with Daryl Turnage and Adeline Wesley. We have not identified a leader. We are all equal members in this group. Okay, so we're going to go on to the first question. What is the status of those who were nearly covered? The Affordable Care Act continues to champion the cause of many previously marginalized individuals, especially those with pre-existing conditions. Today, however, those individuals continue to benefit under provisions of the Affordable Care Act, in addition to promoting women's health through preventative health services and screening, mental health, and substance use support, and reducing disparities. The health of older adults and the disabled by eliminating lifetime dollar caps on essential health benefits, and coordinate events to reduce health disparities for. Question 2. What are exchanges and how are different states approaching them? As part of its mandate, the Affordable Care Act, upon inception, called for the creation of health insurance marketplace and exchanges, where people can purchase coverage that complies with the Affordable Care Act with state-to-state variations of implementation. These insurance exchange portals are used by healthcare consumers to purchase private individual and or family plans, allow them to receive income-based subsidies that make coverage affordable. However, individuals who choose to opt out of the marketplace endure no federal penalties, but depending on where they are, may have state-levied penalties, as well as forfeit the subsidies and other attached credits. The marketplace's exchanges fall under four categories at the moment. The first one is federally run marketplace, which are being used by 24 states that fully rely on the federal government as well as its websites and customers' call center for enrollment. 17 states and the District of Columbia have state-run marketplaces that are overseen and operated by the individual state with their own website, call center, independent of the federal government. The third option is the state-federal partnership marketplaces that are federally funded but overseen and managed by the state using federal website for enrollment. There are 6 states that use this category. And the last option is Arkansas, Oregon, and Virginia. These 3 states base exchanges that oversee their own marketplace, which rely on the federal website for enrollment. Question 3. What are some of the key challenges facing state and national policymakers given the current status? The first challenge faced by state and national policymakers can be found in the changes that have been continuously made to reform the Affordable Care Act, one of which is the associated risks to state insurance markets and consumers resulting from the regulatory changes that promote limited benefit products outside of the Affordable Care Act. The second challenge is the uncertain lifespan of the Affordable Care Act. It has posed challenges to policymakers in finding new options to improve coverage for their residents. And the last challenge for policymakers at the state and federal level is creating policies that would cause people to re-enroll and create strategic reform proposals that support all beneficiaries in continuing the Affordable Care Act. Okay, question 4. What does the Medicaid program have to do with the Affordable Care Act? Medicaid was created by the Social Security Amendment of 1965 and provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by the states, but according to federal requirements, the program is funded jointly by the states and the federal government. The Affordable Care Act is the comprehensive health care reform legislation signed into law by President Barack Obama in March 2010. The Affordable Care Act was created with three primary goals. The first is to create affordable health insurance and ensure that it is available to more people. The second is to lower the cost of healthcare by developing innovative care delivery methods. The third is to expand Medicaid and ensure that it would cover all adults with incomes 138% below the federal poverty line. This expansion of the Medicaid program was pivotal to increase access to care. The two groups most impacted by Medicaid expansion were low-income adults without children and people who've previously earned too much to qualify for the program. The Affordable Care Act addressed the costs for this expansion of coverage initially by the federal government paying 100% of the cost. However, as of 2020, the federal government covers 90% of the cost. Question 4. How has the health insurance premium been affected? New regulations created by the Affordable Care Act had an impact on employer-based health plans, but particularly affected individual policies bought outside the workplace. The Affordable Care Act reconstructed the marketplace for individuals' coverage plans by creating online sites to compare and choose plans. The Affordable Care Act individual's mandate was key to the success of the new marketplace. The theory was that bringing more healthy young people to the market would decrease costs for everyone. Okay, the next question. What variables are in play in the political debate over the impact of the Affordable Care Act on cost, access, and quality of care? Opinions on the impact of the Affordable Care Act are divided mostly along partisan lines. There are passionate political debates over the Affordable Care Act's effect on cost, access, and quality of care. The cost of healthcare is at the center of any healthcare policy debate. Some policymakers believe federal programs that provide healthcare coverage are too generous and inappropriately burden taxpayers. They seek to narrow eligibility requirements, therefore decreasing those covered by programs such as Medicaid. Other legislators are focused on increasing the number of insured individuals by broadening eligibility. However, this approach would likely increase federal spending. There is another debate over federal control over the price of healthcare services and products. Some support encouraging new entrants, blocking mergers, and aggressively policing anti-competitive behavior, while others propose allowing the market to sell itself in order to provide stabilization. Another topic of debate concerning costs is the overutilization of health services by consumers. Some policymakers have suggested increasing cost sharing in hopes that consumers will become aware and try to save money with their insurance. Question 7. On balance, has the Affordable Care Act been a good or bad law? In 2022, an estimated 27.6 million individuals in the United States lacked health care insurance. Based on the population estimate of 324 million for both 2016 and 2022. Comparing the ratio of population to uninsured individuals between these years, there's a slight decrease from 11.89 in 2016 to approximately 11.74 in 2022. This ratio represents the average number of people per uninsured individual during each respective year. Question 6. What variables are in play in the political debate over the impact of the Affordable Care Act on cost, access, and quality of care? Throughout 2016, Donald Trump voiced strong criticism over the Affordable Care Act, referring to it as a disaster. He made a commitment to dismantle it. Now, when he became president, he made changes to the Affordable Care Act. He eliminated the individual mandate, which in the past, if you did not have health insurance, you were charged a penalty. And the second change he made was he removed payment for the navigators. These are people who knew how to navigate